So, without further delay, Dr. Richard Johnson is a professor of medicine at the University of Colorado. Dr. Johnson is a clinician and a medical scientist who has been internationally recognized for his work on sugar and especially fructose and its product uric acid.
It's really a great pleasure to come back and to talk to my friends. So the cardiometabolic epidemic, I mean, it's so apparent to all of us that there's an increase in obesity and diabetes, as well as in high blood pressure and heart disease. And although heart disease has been decreasing in recent years, a lot of that is because we're just getting more efficient at treating heart disease. Not just an increase in metabolic diseases like the classic ones we've talked about, but there's also an increase frequency in diseases that we don't naturally just attribute to a metabolic disorder, but diseases like Alzheimer's disease and certain cancers that are associated with obesity, like breast cancer, colon cancer, liver cancer, and pancreatic cancer, are also increasing. And in fact, we now recognize that metabolic syndrome has the classic association shown on the left. There are these other associations with metabolic syndrome on the right that include neurologic diseases, behavioral diseases, cancer, preeclampsia, sarcopenia, and even aging has been linked with metabolic syndrome. So today we're going to talk about our insights into what might be driving these conditions. And although I've historically focused on the classic associations, in this talk we're going to talk about some of the newer associations and how they might be related. So the big question is what are causing these epidemics? And of course, everyone has learned and has heard that, it's from bad habits. That the problem is that the food is very delicious and hard to resist, and we are eating more, and we definitely are eating more, and we're being more inactive because of TV and all the stuff, the internet, R's, etc. And so it's really thought to be a disease, a tragedy, of our own success, where we are eating too much because the food's too palatable and easy to access, and we're exercising too little. And the consequence is that the extra energy is stored as fat. But we know that altering behavior by eating less and exercising more doesn't always work. It often works for a little while, but there's a big relapse rate. And so this raises the question that it may not just be a behavioral issue, but may in fact involve, biologic mechanisms. And in fact, what we've learned is that, in the wild, animals regulate their weight very well. And during the summer, animals generally will not increase their weight. If they eat more one day, they'll eat less the next. They know how to regulate their weight. They know what percent body fat they want, and it's usually like 10, 15%. But for some animals, they will purposely become fat, like before hibernation or long distance migration or nesting. And these animals will suddenly, like several months before the event, before the winter comes or before they migrate, they'll start to change their behavior where they're eating more, they appear to be hungry more, and you can show that they're developing leptin resistance where they don't respond well to leptin. And so leptin is a hormone that stimulates satiety. And so these animals seem to be continually hungry and eating. They actually become insulin resistant, which may help maintain glucose levels in their blood for the brain when there's no food around, because the brain can use some glucose independent of insulin. And these animals will also store fat in their livers and in their, not just their adipose tissues, but in their blood. And really, when you look at it, you say, my gosh, these guys are developing metabolic syndrome, but it's not pathophysiologic. This is what they need. It's like a type of fat storage syndrome that they need to survive, because when they hibernate, they will burn that energy, and that energy, or burn that fat, and that fat will produce the energy they need. So in this scenario, it's the same equation. They're eating too much because they're hungry and leptin resistant, and they're burning too little, they're burning less fat, but in this case, their fat oxidation process has been blocked. And the result is that they do increase their fat stores, but it's in this situation, they are eating more because they remain hungry, and they sit more because they have less energy. So what's the trigger that triggers this? And could that be related to what happens to humans? Well, it's been known that some of these animals will eat large amounts of fruit in the fall that seems to coincide with the triggering of this biologic switch where they suddenly become hungry, leptin resistant. And when I talk about eating fruit, I don't mean like eating 1 or 2 fruit a day. I mean like eating 10,000 grapes in a 24-hour period. And that's what the bear does. And it's sort of amazing how much fruit they will eat. Well, fruit contains a sugar called fructose, and that's the main nutrient in fruit. And fructose turns out to be very, very, it's a sugar that really can switch animals into kind of being hungry and eating more and becoming and developing the metabolic syndrome. And if these were our brothers from the same litter, and one was offered fructose in the drinking water, the other one not. And in the first week or two, when they're drinking the fructose, they'll eat less chow. They actually try to regulate their weight. But after about 2 or 3 weeks, that regulation of weight goes to haste, and the animals just start eating more and more and become fat.